Hi guys, I am Patrick Wacalio from 4 Clinical Pharmacy, and I'm going to discuss to you something about the drug information about Vancomycin. Let's go! Didn't you know that Vancomycin is a water-soluble glycopeptide antibiotic that has a molecular weight of 1,500? It is also considered as one of the most stable antibiotics in the clinical use today. Aside from Flavobacterium, it is widely used against gram-positive bacteria infections and is known to be produced by bacteria such as Streptococcus orientalis and Amycolotoxis orientalis. Ever wonder how Vancomycin works in the body, or what is its mechanism of action? Well, primarily Vancomycin is a cell wall inhibitor, which means it inhibits the cell wall synthesis of the bacteria by binding firmly to the D-alanine terminus of the nascent peptidoglycan pentapeptide, which inhibits the transglycosylase enzyme, preventing further elongation of the peptidoglycan and cross-linking, which will make the cell membrane and the peptidoglycan weaken, making it more susceptible to lysis and contributes to its bactericidal effect. For the pharmacokinetics of Vancomycin, it is poorly absorbed from the intestinal tract and is usually orally taken for colitis that is caused by Clostridium difficile. For the IV route, 1 gram of this drug will produce 15 to 30 micrograms per ml, which lasts for 1 to 2 hours, 90% of which will be excreted by glomerular filtration. How about the adverse effects? The most common adverse effect you'll see in Vancomycin is red neck or the red man syndrome, which is caused by the release of histamines, as well as chills and fever, and there is also pain in the site of injection, which will cause phlebitis. So what are the clinical uses of Vancomycin? Well, it can be used against antibiotic-associated colitis, which is caused by Clostridium difficile. It can also be used with cefotaxime for meningitis, and it also can be used with gentamicin for enterococcal endocarditis with patients having severe penicillin allergies. It can also be used IV or intravenously for bloodstream infections and endocarditis. So that's it. I gave you some drug information regarding Vancomycin, and I hope you learned a lot from it from a short span of time. Thank you for listening. This is Patrick Wacalio from 4 Clinical Pharmacy. Goodbye.